Hi, my name is Scott Clark. I'm the practice manager here at Gastroenterology Associates of Gainesville. I've been here at the practice for a little over 13 years. Originally from Indiana, but moved to Georgia almost 35 years ago. Went to med school at the Medical College of Georgia. Went back up north for my residency at Indiana and Ohio State. I've been here at this practice since getting out of my fellowship training. I have two great kids. My daughter is starting her freshman year at Georgia this fall. My son's going to be a freshman in high school this next year. I think what makes our practice unique is the way our staff gets along with everyone. The doctors, the mid-levels, the employees all seem to work as one team. We don't have a one person that kind of dictates what everyone does. So everything here is done by committee, done by a democratic vote, so nobody's upset with anybody at any one time. We all tend to work together and try to get things done for the better of the patients and for the better of our practice. I'm going to talk today about celiac disease, which is becoming more and more common here lately, and gluten sensitivity has got a lot of press over the last several years. Celiac disease is an abnormal response of the body to gluten that in turn damages the small intestine and more specifically the small villi or small hairs in the small bowel that leads to malabsorptions. Luckily and typically, avoiding gluten can make a big difference in your symptoms, as well as make the villi in the small bowel reverse and go back to normal again. Symptoms can range from no symptoms at all to severe diarrhea, to weight loss, to bone loss, to liver disease. So it has many different ways it can present itself, and no two people are exactly the same. It's also associated with many other diseases that again you don't associate with celiac disease, but we do see them quite frequently here in the practice, and those include type 1 diabetes, osteopenia, osteoporosis, liver disease, skin diseases and rashes can often be caused by celiac disease, including dermatitis or herpetiformis, which is the most common and which we see quite often here in the practice. Diagnosis is fairly simple. It can be done with a simple blood test here in the office, where we check for an antibody in your blood that makes you more likely to have celiac disease. And if that is positive, then we back that up with a small bowel biopsy to go ahead and prove that the antibody was a positive and was a true positive, and then you have the diagnosis. There are different degrees. Some people have what's called potential celiac disease, where they have a positive antibody but a negative small bowel biopsy. For these people, we tend not to tell them to go on a gluten-free diet unless they develop more symptoms or develop vitamin malabsorption. And there's also silent celiac disease, where they have a positive antibody and a positive biopsy, yet have absolutely no symptoms of the disease or have any evidence of vitamin or other deficiencies. So how do we treat celiac disease? Of course, we start with a gluten-free diet. The nice thing that's happened in the last few years, all grocery stores now have gluten-free sections, which make it much easier to know which foods are the right ones to get. It's also it's happened in the last couple of years where the FDA requires people or manufacturers to, if they say it's gluten-free, it has to truly be gluten-free, where in the past manufacturers could say it was and truly was not, so that makes a big difference. But we also think it's important for people to become involved with advisory boards, with other groups. I know there is a group in Athens that meets regularly that have celiac disease, and also in Atlanta that meets regularly to discuss different recipes and different information about the disease with other people that have the disease as well. So there are good ways out there to get good information about the disease process. I want to thank you for taking the time to watch the video. We'll be glad to see you here in the office to start a workup if you think you have any symptoms, or certainly if you have a family history of celiac disease, it's important to get checked out. A simple blood test in the office can get us started, and we look forward to seeing you.